Hi, my name is Russell and I consent to this video. I'm in.
Hey, Mr. Vargo. My name is Serena. I'm going to be your nurse today. I'm just here to do a head-to-toe assessment on you, and that's going to give us a baseline of what's going on with you, okay? All right, can you tell me your name and date of birth?
Russell Vargo, March 25th, 1995.
Perfect. Let me shut the door to provide you some privacy. All right, Mr. Vargo, I'm going to start off by asking you some questions, okay? Do you know what year it is?
2020,
Do you know who the president is?
Trump,
Do you know where you are?
my room.
Have you had your flu shot this year?
I have.
Do you have any allergies?
No.
Any medications that you're on currently?
No.
Any prior procedures or medical history you feel is pertinent for us to know? No?
Nothing major, no.
Are you in any pain at all today?
I'm not.
So on a scale of 1 to 10, would you say you're a 0?
Correct.
Okay. I am going to just check. I'm going to palpate your head and your face, and that just means to feel around, okay?
Okay.
Alright, I'm just checking for any lesions or masses. His skin is pink and warm to the touch. I'm just going to palpate the maxillary sinuses. Is any of this tender?
Mm-mm.
And the frontal sinuses? Any tenderness? Okay, there's no swelling or masses or lesions present. I'm going to check your nasal passageway, okay? His nasal mucosa is pink and moist with no lesions. And can you say ah? Stick and lift your tongue up. His mouth, you can close. The roof of his mouth, under his tongue, his buccal mucosa is all pink and moist with no lesions. And upon arrival to his room, his speech is appropriate. He's alert and oriented, and he presents well kept and pleasant. I'm going to check your ears now. There's no drainage present, no lesions. Are you having any trouble hearing or anything like that?
No.
Do you use any hearing aids or anything like that to help you hear?
I don't.
Okay, no lesions. Alright, and how is your diet?
Pretty good.
Yeah, you eat a lot of fruits and vegetables?
Yeah.
Mostly fruit?
Yeah, I don't like vegetables.
Okay. And do you have an appetite? You like to eat? You feel like you're hungry?
Yeah.
Okay. Alright, so I am going to check your eyes now, okay? So I need you to just look straight forward for me. I'm going to shine a light in your eyes, okay? Look straight forward. Good. Okay. And then I need you to just follow my pen light. Follow the pen light, please. Thank you. Alright, and I'm going to ask you to follow it again, okay? So his pupils are round and reactive to light. They are equal, and there's accommodation, and the 6 cardinal positions are good. And I'm going to have you pull your eyelids down like this. Good. His mucosa conjunctiva is pink and moist. His sclera is white. And let me check your cornea. Look straight forward for me. Good. And do you wear contacts or glasses or anything like that?
I do not.
Okay. And so now I'm going to ask you, I might have already asked you to do this, but I'm asking you to do it again. Can you puff out your cheeks? Can you smile for me? Stick your tongue out. Like this. Ah. Good. Alright, so his face is symmetrical. His lips are symmetrical and pink and moist. I'm going to move down to your neck now. I'm just going to palpate your lymph node and just make sure there's no lesions or masses or swelling. Everything feels good. Now I'm going to check. I'm going to check your carotid pulse. I'm going to check over here. Good. listen. Good. There's no brewy present. So I'm gonna have you turn your head to the side, to the other side, backwards, forwards, shrug your shoulders. All right, good. And before I have you lay back, so I can check your neck for any vein distension, I'm gonna go ahead and just listen to your lungs, so I can do your front and posterior. Okay. All right. So let's do your heart first. Okay. Alright, so I'm going to have you take a deep breath for me. Good. Let's check your anterior. Can you lift your arm up for me? Good. So you can go ahead and lay back at a 45-degree angle for me. His heart had no murmurs, no rubs, and his lungs had no adventitious sounds. All right. Can you put your chin up like this? All right. There is no JVD present. So we're going to go ahead and move on down, and I'm going to check your range of motion in your arms, okay? So I'm just going to have you lift them up and let them down and out to the side and back in and bend them and then bend your wrist. Move your fingers. Okay. That's good. That looks normal to me. I'm going to just go ahead and take a look, and I'm going to feel your pulses real quick, okay? So put your hands up for me. Checking on radial pulses. They're good. Good. Check your skin. His arms are pink and warm to the touch. Let's check your hands. There's no lesions or masses. No clubbing present. Cap refill less than 3 seconds. Same on this. So I'm going to just check the strength of your extremities. I'm going to have you press against my hands, and then I'm going to press against yours with your arms, okay? With your arms. Press against me. Good. And I'm going to press against you. Good. And you're supposed to press against me when I press against you. Okay, good. His strength appears adequate. All right, so I'm going to move on to your chest now. I know I already listened to your lung sounds and your heart sounds, but I'm going to have you, I'm just going to look at your chest and make sure it's rising symmetrically, okay? So he has no masses or lesions. He does have hair on his chest. It rises symmetrically. All right, and do you have any trouble breathing or difficulty breathing ever, shortness of breath? Okay. I'm going to go ahead and move down to your abdomen now, okay? When is the last time you pooped?
This morning.
Was it normal?
It was.
It was soft and easy to get out?
Mm-hmm.
Okay, and we kind of already talked about your diet. Said you eat a lot of fruit, not so much vegetables.
Mm-hmm.
Okay. All right, so I'm going to listen to your abdomen and just assess for bowel sounds to make sure that everything is moving around in there the way it's supposed to. And then I'm going to feel around on there, and I just need you to tell me if there's any tenderness, okay?
Okay.
All right. I'm going to start in the right lower quadrant, okay? Did you just eat ice cream or something?
I did. Me and my diddle.
Okay, I'm gonna feel around now. Just let me know if anything is tender, okay? Good. All right, I'm just gonna take a look real quick, okay? abdomen. Skin looks pink. It's warm to the touch. It's symmetrical. All right, so let's move on down. Can you bend your knees for me? And put them out straight to the side and back in, and bend your foot. Good. Wiggle your toes. Perfect. And I'm gonna have you kind of lift your leg up into like a 90-degree angle, and it like lift up into the air. And I'm gonna have you press against my hand, okay? All right, now I'm gonna press against yours. Okay, same thing for this one. Okay, strength is good. I'm gonna check your pulses. Popliteal. Good. Good. His skin is pink and warm to the touch. He has hair on his legs, which shows good perfusion. His legs or toes are good. Good. And do you use any assistive devices to help you get around?
No.
Okay. Alright, so I'm going to have you sit up for me because I'm going to have you get up and walk, okay? So you can get up and just walk for me. Alright, that looks good. You can go ahead and have a seat. And now I'm just going to check your vitals and then we will be all done, okay?
Okay.
Alright, let me grab my blood pressure cuff. Did anybody let you have a service dog in here?
Muffled.
There it is. Okay. Alright, blood pressure is normal. And I already assessed his radial pulses. Respirations within normal limits. And I would also check his temperature and his pulse ox. Alright, Mr. Vargo, do you have any concerns for the day?
I do not.
Do not? Okay. Well, if you do, you just know how to, do you know how to hit your call bell?
I do.
Okay. You just hit that button and we'll come in and help you, okay? Alright. You have a great day, okay?
Alrighty, you too.
Alright.
Bye, Diddle.